Life Unrehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
Welcome back to Life Unrehearsed. My name is Matt Del Vecchio, specializing in life transitions, downsizing, and the senior living industry.
And I'm Corey Sorota, a clinical social worker and psychotherapist specializing in grief and loss. Matt, have you noticed how all these quote-unquote, air quote, women problems start with the word, like I'm talking menstruation, mental breakdowns, menopause? What is up with that?
Wait a minute, Corey. You went off script here, Corey. I'm not really ready for some. That's a loaded question. How can I answer that one without getting in trouble?
You can't. I'm
pleading the fifth, Corey. I don't know. I don't have an answer.
Okay, that's a good answer. That's a good answer. Well, luckily, we do have someone who does have some answers, and probably many. Dr. Lucy Gilbert is on the line with us. She's the director of the Gynecologic Oncology at McGill University and McGill University Health Center. Dr. Gilbert heads the Women's Health Research Unit of the MUHC, and she will be sharing some myths and facts with us about menopause. Dr. Gilbert, welcome to Life Unrehearsed.
Hi. Thank you so much for having me.
So there's lots of them. There's lots of myths and facts out there. So I'm just going to, I guess, throw some out there, and you can please shed some light on them. Number one, menopause is a sex killer.
It really isn't. Having said that, I'd like to qualify it because menopause is a period of transition, and some of the symptoms can be very unpleasant. And women are in some ways a little different from men in the sense that they have to feel good and be in the mood and not feel unwell to have a significant libido. And if you have a lot of menopausal symptoms, that can affect libido. But there are very effective treatments for those symptoms, so you shouldn't let menopause be a sex killer.
Okay, that's pretty encouraging for the male population out there, Dr. Gilbert. And, you know, first of all, so glad to have you back on Life Unrehearsed. You are a wealth of knowledge and so pleasant. So perhaps menopause is not a sex killer, but certainly need to be understanding of all the changes that are going on. Another potential myth out there, Dr. Gilbert, is, are all menopauses created equal?
No, Matt, not at all. To refresh your listeners' memory, menopause is when estrogen levels vanish, when they disappear, and then it creates problems. Now, some women are lucky, and the fall in estrogen levels, the ovaries start failing very gradually, and when any change is gradual, it's kinder on the brain and on the body. So some women just glide through the menopause because their ovaries fail gradually, but some are very unlucky. And what happens is the ovary tries so hard as it's failing, and there'll be surges in estrogen levels, and the next minute it's crashing down. And so it's like a roller coaster ride, and that is immensely unpleasant. And unfortunately, about 30% of women do have a very dreadful time with the menopause.
That's Dr. Lucy Gilbert from the MUHC talking to us about menopause. And I hear you, the roller coaster. I feel it. I hear it. I know it. My poor partner, he feels it. He hears it. He knows it. But yeah, we're trying to make the best of it. So another myth or fact, absolutely nothing can be done to reduce menopause symptoms.
That is, again, a total myth, because so here we are talking about a very powerful hormone, estrogen, which we were lucky to have from about 10, 11, and it was there till we are about 48, 49, 50, and that drops. Now, again, poor Matt will think I'm having a poke at men, but God has been unfair to women in the sense that men do not suddenly lose their testosterone. And this happens to women, and you do not, if it's giving you significant symptoms, it can be replaced with exactly the kind of estrogen that your ovaries were producing. And you mustn't think just because it's natural, oh, this is a natural event, we have to suffer. If you're not suffering, that's fine. Don't do anything about the menopause. But if you're suffering, I would use the analogy, if it's raining heavily, if there's a thunderstorm, that is natural. It's a natural phenomenon, but you're not going to stand in the rain and get soaked. So a lot can be done about menopause symptoms, but it must be done efficiently and safely.
Okay, so fair enough. I just wanted to add to that. So when you say something can be done, I'm thinking you're talking, or are you talking about hormone replacements? Because I have very big concerns about hormone. There's lots of, and maybe this is another myth, that they're linked to breast cancer.
Yeah. So really, it's as we grow older, our risks of cancer increases, and what we now have is what we call level 1 evidence. It's the highest evidence that estrogen by itself, its risk on breast cancer is very, very small. So 92% of all breast cancers occur in people who have never, ever been on hormone replacement. Now, the combination of estrogen and progesterone taken for a time does increase risk of breast cancer. So that is why menopause symptoms has to be treated carefully by somebody who understands these hormones and who are in touch with the current literature. But estrogen, I want to emphasize again, estrogen replacement by itself has categorically been shown not to increase risk of breast cancer. But you cannot take estrogen by itself if you have a uterus. So your doctor must be have the knowledge to give progesterone in a way that doesn't affect the breast.
Such a wealth of knowledge. You know, Dr. Gilbert heads up the Women's Health Research Unit of the MUHC, and we're talking myths and facts about menopause. Such great insight. And one of the facts or myths, Dr. Gilbert, is about weight gain. Weight gain during menopause is inevitable.
Matt, weight gain is nothing to do with the menopause directly. Now, having said that, because weight is from calories, if you take more calories in than you burn, you'll gain weight. However, you can see children running about, and you can see how easily they burn calories. Unfortunately, as we grow older, we move less, and the way we burn calories are less efficient. So we do have to be careful. We cannot eat what we ate when we were 30 and running around as we go through the menopause. So we have to reduce calories, reduce carbohydrates, and up the exercise so that you are burning more. So, and one important point is estrogen, the hormone is devised to keep weight off the abdomen and shift it to the breast and hips. During menopause, if you do not have replace estrogen, there is unfortunately a bit more fat put around the abdomen.
Fair enough. I hear you. So we have to go to a traffic break, but when we come back, we are going to hear from Dr. Gilbert. She's going to talk about whether there is something that a partner can do either to help or hinder helping their partner through menopause.
The men want to be listening to this one.
We'll be coming back right after our CJAD traffic update.
Live Unrehearsed on CJAD 800. Brought to you by Marco Vendramini of IG Private Wealth Management. MarcoVendramini.com.
Welcome back. You're listening to Life Unrehearsed. I'm Corey Sirota, along with my co-host Matt Del Vecchio, and we are talking to Dr. Lucy Gilbert about myths and facts around menopause and a little bit about how to navigate menopause. So here I asked right before we went out to traffic about which way, kind of a good, bad, or indifferent, your partner can help somebody who's dealing with and going through this experience. Their hormones are changing, their body shape is changing. What are some things a partner can do to help or hinder through this process?
So Matt and
I'm
Corey,
listening.
Taking
I
notes.
want to thank both of you really for giving this topic time and for your wonderful questions. So partners can do a lot, because it's to understand that this, although it is a physiological disorder, all women, if you're lucky to live until 50, 52, you have to go through it. But 30% of women do suffer terribly. And to understand that this is a real problem, it's not a made-up problem, and to help women seek help if it's getting too much. See a doctor, get treatments. Little things like if sleep becomes a huge problem, you're throwing off your bed covers, you're putting it back on again, and to have the patience to help women navigate it.
I love that you just said that, because my husband's living with it. I literally have a fan that goes off, covers off, covers on. So we joke about it. He's got a great sense of humor about it, and he's really very patient. So, but that is part of the key. So you did mention sleep problems. Do they definitely have something to do with menopause?
Yes, absolutely. So I said that menopause is because of estrogen drop. And we have a center in the brain called the thermoregulatory center, and it's like a thermostat in the brainstem, and it's very sensitive to estrogen. And if estrogen keeps fluctuating, falling, going up, falling, it goes berserk. So you have these hot flashes, night sweats, and you really, 1 minute you think you're very cold, 1 minute you think you're warm. So that per se interferes terribly with sleep. So it's a real problem, and if you don't sleep properly, you're tired the next day. And again, the most effective treatment for that happens to be estrogen. Now, there are some women who cannot take estrogen because of medical problems. Then we can work with you and come up with alternatives. Okay?
You know, I'm listening to you between the covers going back and forth and my snoring and the dog up and down. We're lucky to get an hour of sleep a night. Oh, boy. Dr. Gilbert, you head up at the MUHC's Women's Health Research Unit, and we'd be remiss if I didn't bring up the Theyre project, Dr. Gilbert. You're heading up this incredible initiative, and let me just remind our listeners about the Theyre project. It's a research clinic to ensure that eligible women are offered easy, fast access to imperative yet specialized medical examinations, which will consequently allow for the early detection and diagnosis of ovarian and endometrial cancers. Such an amazing initiative, Dr. Gilbert. You founded it. You're heading it up, and this is worldwide, and it's right here in our own city at the MUHC. So, first of all, congratulations for all your efforts. And can you provide our listeners with an update on the project?
Okay. So that project has been going on for a while, and it's free. You don't need a doctor's referral if you have any symptoms. Most cancers do occur after the age of 50. So please, any woman after the age of 50, if you have any symptoms, please call the number. It's 1-866-716-3267, and you'll be seen promptly and dealt with.
And Dr. Gilbert, we're going to ask you to repeat that number one more time.
1-866-716-3267. And Matt, before I go, I want to say that in mid-October or so, we'll be adding a genomic Pap test to help early detection, and I can come another time and talk about it. But now we offer CA125, which is a blood test, and ultrasound.
It's quite an amazing initiative, just to go from almost the unknown in such a long period and sometimes very painful testing to now you're talking, blood tests and Pap tests, and you're almost there, and so encouraging for women's health and women around the world, quite frankly, will benefit, and subsequently men will also benefit from that as well.
Thank you so much.
Well, no, thank you very much, Dr. Gilbert. And yes, we would love to have you back on once you have more of an update at the latter part of the year. So thanks for coming on, taking some time on a Sunday. We know you're extremely busy.
Take care. Bye-bye.
Thank you. Take care.
Now, Corey, we've got quite a few things coming up for the month of September. There's loads of very interesting topics, and we're working on right now. And can you start us off with what's coming on next week?
Very excited about. We've had her on before, but this is something new. Public speaking coach Susanna Baum is going to teach us useful tips and techniques about how to improve your video conferencing and presentations, which in a time of COVID-19, I can't wait to get more useful information from her. So I'm looking forward to that.
So timely. I don't know if you've seen some of the videos out there of some of the mishaps.
Yeah,
and,
I'm tired looking at people's nostrils.
Yes, lots of nostril hair being shown there, and we need to improve on that. Eye level, people. And we are also going to be talking about how the performing arts community is surviving these days. We're going to have a wonderful lady talking about the arts. We also have Larry Day, who you may know. He's very well known in the Montreal entertainment industry. Heads Up Strangers in the Night. That took a big hit this year, but they've got some alternative plans. So we're going to be talking about that next week. And thank you for listening. Many thanks to our technical producer, Dave Simon. And you can catch us every Sunday on CJD 800 at 4 p.m.